Hello, my name is Kelvin Christian, and I'm an occupational therapist student. Today I would like to talk about a case study analysis written about Dr. T. Dr. T had spinal stenosis, which decreases the space for the spinal canal that may cause impingements of the nerves, which can be from a bulging disc, narrowing of foramina, or other degenerative conditions. The pressure on the nerves may cause weakness or discomfort, like back pain. In the case of Dr. T, one medical management would be a laminectomy. This procedure involves surgically cutting out the vertebral lamina, which then relieves pressure on the spinal cord. After the procedure, Dr. T only had a small amount of spinal cord left in his neck and was only able to move his right big toe. This resulted in Dr. T becoming a quadriplegic and a total decrease of body function. To address Dr. T's loss of ADL independence, he started to work with occupational therapists to gain the strength and coordination needed to accomplish his goals. For our first intervention, we're going to use therapeutic exercises to help Dr. T with his goal of safe transfers. With therapeutic exercise, we're going to use it to increase Dr. T's range of motion. But first, we're going to use a preparatory activity known as proprioceptive neuromuscular facilitation, stretching, to help Dr. T to get that movement and blood flow to the muscles to improve his balance and decrease any rigidity for the exercises. So, PNF stretching techniques are used to increase range of motion by training stretch receptors to get used to a new range of muscle length. So first we're going to have Dr. T stretch out his right hand and bring it up and across. His midline all the way up to his shoulder. And we hold it there for about 5 seconds to get that stretch going. And then after 5 seconds, the occupational therapist will come around and push a little more to really get that stretch going for about another 15 seconds. Then come back down, follow through. Yep, perfect. Same thing with the left side. Come down, and it'll come up. Yep, as much as Dr. T can. Alright, and then hold that for 5 seconds and push for 15. Now obviously Dr. T might feel a little pain because he probably hasn't been using that a whole lot. So we want to go past any pain because we don't want Dr. T feeling too much pain. So we'll come back down and follow through. Perfect. So as we know, Dr. T is having a little difficulty with his fatigue. So as we're getting that blood flowing, hopefully that will help Dr. T to be able to do the next exercise and get that blood flowing through to the muscles necessary for it. So as I said, for the intervention, we have the therapeutic exercises, and we're gonna hit a balloon. So, first things first, we're gonna use that right hand. Go ahead and hit it back through me. Perfect. Alright, come across. Alright, yep, sit up straight as much as you can. Because remember, we're going to want to sit up straight to be able to transfer ourselves and to be able to move around the house. So let's do that. Perfect. Oh, perfect. Yep. Try to come all the way through to be able to follow through to that range of motion. Awesome. That was awesome. Alright, switch to the other side. Come through. Alright. So try to bring the arm down and try to stretch out a little more so that you're able to not compensate so much with the shoulder, but be able to get that full movement for your shoulder. Perfect. Alright. So with that therapeutic exercise, it'll help Dr. T to increase his stretching, his balance, and even his range of motion. For our second intervention, we're going to do task-specific hand training. As a preparatory activity for that intervention, we're going to use an ultrasound treatment. This treatment works by sending sound waves that create a gentle heat. This heat will help the deep structures beneath the skin to increase blood circulation and reduce stiffness. This method has been shown to decrease back pain scores and improvement of disability. So first things first is we're going to hit that affected area between the C3 and C7. And this will hit the nerves to release any impingement or stiffness that may be occurring around that area, and as well increase blood flow, blood circulation. After hitting the neck, the affected area, we're going to come down to the hand, because this is where we're really trying to work for our task-specific hand training. So we're going to increase blood flow in this area and reduce any stiffness. So first we're going to hit the dorsal side and come over to the ventral. Same thing. Alright. Then we're going to switch over, same thing on the other side as well. Alright. So that preparatory activity will help us lead into our intervention, which is task-specific hand training. Specifically, we're going to do a hand therapy putty exercises. These exercises can include 3 different exercises. So first things first, we're going to test grip. So we're going to have Dr. T hold on to that, and Dr. T squeeze in. Perfect. So we're going to have him squeeze as much as he can, and this will help increase grip strength, which is very important for the ADL of eating. Perfect. And then we do the exact same thing on the other side as well to really test that grip strength. Awesome. Next exercise to help with the fine motor. We're going to have Dr. T place his hand on top of a flat surface, and on top of the flat surface we're going to have putty. And Dr. T will place his hand on top of that putty and start out with his hand curled in and slowly extend. Yep. Now we're going to bring it back in. Perfect. So this will help with his fine motor skills, that where he can do his goal of using a computer, typing. So go ahead and extend. Bring it back in. Perfect. Our last one that we have is we're going to have Dr. T working on his opposition reposition. So bring your fingers in. Yeah, perfect. Alright, so we're going to have putty wrapped around those 2 fingers. Dr. T will bring them out. Yep, go and spread it out. Good job. Good work. Alright, I'm going to do it to each and every finger, every 2 fingers. This is thumb and the other 4. Stretch it out. Perfect. So we do that with every finger. Of course, Dr. T at first is going to be a little weak, but as time goes on, he'll be able to increase that strength with the grip strength and extending the fingers and the opposition and reposition. So as he continues to do that, to be able to start using the computer. In conclusion, these 2 interventions work specific muscles to be able to improve the strength and endurance of Dr. T for increasing range of motion, for reaching and grasping items, for eating and other activities of daily living. The therapeutic exercises work on your shoulder flexors, such as your anterior deltoid and pectoralis major, your elbow flexors, such as your biceps brachii and brachialis, and your elbow extensors, such as your triceps brachii. The hand training intervention will work on your extrinsic hand muscles and your intrinsic hand muscles. For your extrinsic, you got your flexors and your extensors to grab items, and you got your intrinsic hand muscles, such as your thenar compartment, hypothenar, interossei, and lumbrical muscles, to be able to work that fine motor.